back to the line. As the coronavirus starts its spread in jails and prisons, advocates and activists are petitioning for the release of some prisoners to protect them from COVID-19 and also from prison workers, especially. Others want to put a stop to that idea to protect themselves from released prisoners. Surge petitioners are not asking to open all jail cells, but just honestly to step up the release of prisoners who don't pose a threat to public safety. And this is this is beginning to be a hard sell for the public in some circles. Can the governor be doing something a little bit better here about this message?
Well, I mean, I think the playing up the public health aspect of it is going to be more palatable to many folks if they recognize that it's not just the prisoners we're talking about, it's the staff, it's the correction officers, it's all the folks who daily have to go in and out of the prisons. It is inviting a slightly more self-centered viewpoint, I suspect. I mean, I concede, but that's probably going to be the easiest sell is, on this one. From my standpoint, you've heard me on this show many times before, but I think it's an important moment to think about what it is we're trying to do with our correction system and really, really focus on who needs to be locked up and who does not need to be locked up. And, this is probably not a moment for folks are going to be impassioned or dispassionate, I should say, and thoughtful about the real risk to the community posed by, folks who are in prison because of technical parole violations or nonviolent offenses, or we're about to be released anyway. But it is an opportunity to see what happens and have that conversation going forward. Right. I think the messaging could probably be better focused less on release of prisoners and on decreasing the risk of contagion among the staff and the corrections officers.
Interestingly, Julianne, when I see certain circles complaining about this, they're talking about felons being released. I mean, there's all kinds of rumor kind of stuff going around it. Let me kind of go through the list here of who's actually eligible here for the folks watching who may not know. Those at risk of serious illness from COVID-19, that makes sense. Those with less than a year of sentences remaining. Those held on infractions such as parole and probation violations. I mean, we're not talking about hardened felons here. We're talking about folks who are just about to be released, and I just, something's not quite getting across. What's your sense of it as you watch this filter through?
Look, prison healthcare is notoriously failing. It's not a good place to go if you're sick. It's not a good place to get sick. It's a place where you are likely to, contract disease anyway and have a challenge being cared for. And so I think that's one big part of it. I think the other part of it is that none of these people, although some of them may have committed capital crimes in the prison system, by and large, these are not crimes that are punishable by death. And if you contract the coronavirus in a place where you are not able to get appropriate health care, the chances that it leads to that, are there. I don't want to sound like an alarmist, but I think that we need to be very careful about what could happen if there is a significant outbreak within one of the prisons. And thankfully, we haven't seen that yet. We had a positive case in the Santa Fe County Jail, which is just right across the street from the state penitentiary here. They tested 33 people. It was a combination of inmates and corrections workers and other folks who have to come into the prison by nature of their job. And those 33 tests came back initially negative. But I think it's important to keep in mind that first positive test, that individual also had a negative test. Before this. So I don't think we're out of the woods at all in terms of the Santa Fe County Jail or the state corrections system and the risk of an outbreak. And it's kind of, to one of the points that was made earlier, this is a situation of like, if we can do this now, wouldn't it have been nice to have done this all along? In Santa Fe, it's, wow, we've got people living on the Midtown campus, people who are in marginalized housing situations or homeless. We've found a way to give them housing. And we could have done that before this crisis. Same thing with these people who are jailed on technical violations. The state legislature tried to address this issue. They tried a couple times and it didn't quite pass with the impact that, the advocates had hoped for. And so in some ways, I think that this is being viewed as like a way to use the COVID crisis to advance an agenda.
Right.
I think that's part of why there is so much pushback. I have to agree that the pushback doesn't seem to really be about keeping people healthy and safe. It seems to really be about, kind of the bigger issue of why people are incarcerated and how, and it really is something that our state needs to wrestle with outside of this pandemic.
Mm-hmm. Serge, a number of groups are involved with this, including the ACLU, and one of the issues that's come to mind is we do now have in Otero County a positive test result in one of the ICE holding facilities. And this is going to bear watching because this could prove to be very problematic for the governor if things get a little out of control there. But she has limited authority about who can come and go in these facilities. It's quite a dilemma when you really think about it. And I got to think fingers are really crossed up in Santa Fe at this point.
It's not a question of if, I suspect, right? It's a question of when. You've got people crowded together, lots of hard surfaces, poor healthcare, and not a lot of opportunities for the social distancing that we're discussing, and people coming in and out of these places all the time. It is, what do they say? I heard someone describe it like, a cruise ship with bars on it. You're just, everyone's stuck together and there's no chance to get away. And it's an outbreak waiting to happen. And I can't imagine it is not going to happen somewhere in our state at some point. If it hasn't already, we just don't know. And we really have to wrestle with this idea of, the ICE facility is a whole other kettle of fish, but this idea of what do we value more, retribution and punishment, or public health and the health of New Mexicans who, regardless of where they are right now, still deserve the benefits of our health system.
I think it's worth noting too that in addition to this push for the prison system, that's those folks who are held by the state, and also the prisoners who are held by the federal agencies, that people who are being held by the counties are also being, kind of up for early release. You've got both Santa Fe and Bernalillo counties taking some steps to do that. And so you really have all these different levels of control, and they're not acting in concert, certainly, but I think we will see some changes at each level as this goes on in the next week or two.
Right. We got about 2 minutes on this one. Serge, the New Mexico Supreme Court has been petitioned as of this past Tuesday, for this. No clues yet where these folks might be, but the process turns slowly. This is another problematic part of this. It was almost like a race against the clock here, getting some clarity. Do you see anything on the horizon that would allow this situation to be resolved before then? Or I can't personally see it. Do you happen to see an ability to thread the needle here for the Governor Lujan Grisham?
I don't know enough about, I have to give that sort of the ins and outs of how this might work to do that. I will, I was going to say, and I think, anyone who's threading this needle also has to think about, it's not just opening the doors and saying, okay, good luck to you, right? This is a group of folks who have, who will need support, social support, financial support, right? And if we say, okay, we're going to do this in the interest of public health and send people back to their homes and their home communities, but then don't give them support, it's basically hamstringing, the whole idea of increasing public health, increasing the public welfare by doing this. And so I think it's also important to think about what happens next and dedicate some thought and some resources to what happens when the doors close behind somebody, right? We have that problem in the best of times, but
that's right.
In a situation like this, and it's worth doing, but it's also worth doing right.
Exactly right. Hey guys, we're up against the clock, so we'll have to leave it there. I want to thank you both. This has really been terrific. And I know it's a bit of a difficulty to kind of do these things from home. So we appreciate your patience for sure. One quick note, the criteria I mentioned for release, and that's what the ACLU and defense attorneys are asking for, not what the governor is using. There's a distinction there. At last check, 14 prisoners had been released.